this module, we're going to look at safety issues of bronchoscopy. And I think safety issues are very important, and anyone who is embarking on a bronchoscopy should be very aware about the safety issues. Now, bronchoscopy traditionally, a flexible bronchoscopy is a safe procedure. The reported complication rates are less than 1%, it's 0.08 to 1%. And the typical problems that are associated with bronchoscopy are pneumothorax, hemorrhage and respiratory failure. And much of it depends on what the pre-morbid conditions are for which the bronchoscopy is done. And the pneumothorax rate is pretty low, but it gets a little higher when you do a transbronchial lung biopsy. Procedure-related mortality in bronchoscopy is extremely rare. It's less than 0.05%. When they looked at retrospective charts of more than 4,000 bronchoscopies done, transbronchial lung biopsy most commonly was associated with complications, particularly 4% of them developed pneumothorax and 3% of them developed bleeding. And that has to go on the consent form, and that has to be informed to the patient. When a patient is subjected to a transbronchial lung biopsy, we'll have to look at these numbers, tell about these numbers, get a consent, and only then you'll have to proceed for transbronchial lung biopsy. In our own country, the PGA experience, a rather huge experience of close to 13,500 bronchoscopies over 12 years, there were only 9 deaths. 215 transbronchial lung biopsies were performed, of which 2.3% had pneumothorax and about 3% showed instances of significant bleeding. I'm just going to take you through the following things. One is, what is the safety for the patients and the safety for the scopes. Both are very important, especially in an economically challenging country like ours. The scope is also very important. What are the absolute contraindications for bronchoscopy when there is no